welcome back to our channel. In today's video, we are going to have Q&A session. So I've recently posted this in our community tab asking mothers to post their questions under the comment section, and many of the mothers have responded, and in today's video I am going to answer all these questions. So do stay until the end so that you also may have your queries and you also get the answers for them. So without further ado, let's jump into the video. So let me remind you that this Q&A session is especially for premature babies. So if you're a parent of a premature baby, trust me, this is really gonna help you in taking care of your premature babies at home. So let's jump into the first question by Mrs. Anjuta Muruga Pupati. So her question is, hi sister, I'm from Sri Lanka. Your videos are very useful for preterm babies and mothers like me. Thank you so much. Please say more about coconut oil feeding for weight gain. My baby is born in 31 weeks. Now he is 2 months old. Is it okay to give him 3 drops 3 times a day? From which age should you start to give coconut oil for your daughter Olive? So yeah, hi Anjita, thank you for writing. Yes, you can use coconut oil that is especially useful for weight gain in preterm babies. That is recommended by doctors and it is a natural way of improving weight for your baby. You can use it 3 to 4 drops per feed 3 times a day, and you can give this feeding 4 to 5 times a week. So you don't have to give every day. You can skip 1 or 2 days in a week. And yes, I've started giving this to Olive when she was 2 months old. I hope this answered your questions. Moving on with the next question, Smita Patak. I think Smita has been with us since long time with the name of Jayesh Patak, her husband's name if I'm not wrong. So yeah, this was really helpful. In fact, couple of days before I was thinking to ask you, put forward my queries to you. Thank you for this. Thank you, Smita. My question is about teething. When these babies complete their teething process, sleeping pattern, my daughter is 2 years old but still awake a couple of times during the night. Also the weight, height and head circumference at the age of 2 years, and my daughter weight is 9.5 kgs at age 2. I'm worried about her height. Hey Smita, thank you for getting back to us. And your first question is about teething. So let me tell you that babies usually complete the process of having the complete set of 20 primary teeth by the age of 3 years old. And as always, premature babies have delayed milestones and delayed everything. So usually babies start teething at the age of 6 months, but however in premature babies it's a little late. So I can say through my experience that Olive had her first teeth almost at her first birthday, that is 12 months. So you can expect your baby to have teething plus or minus of that. In few extreme cases, teething also begins at the age of 14 months. So don't worry about it. If you have concerns, please speak to your pediatrician about it. Coming to the sleeping question, yes, they do wake up in the middle of the night a couple of times, maybe because they are hungry, or maybe they have growing pains, or they have some pain, or they are ill, or they may have nightmares. So there are a couple of reasons. So you can try to find out why your baby is waking up. If they are hungry, try to feed them properly before getting into sleep. But however, that is inevitable. They do wake up. It's a process of they're growing and developing, so that's okay. We still have some nights to sacrifice for our babies. And the last question is about height, weight and head circumference, and you haven't mentioned the height of your baby, so I'm not sure why you're very concerned about it. As I told you earlier, if you have any concerns, please be free to speak to your doctor. And 9.5 kgs at the age of 2, it's okay, not great I can say, but it is like okay, you can still try to get a little more weight. But even if you try, sometimes the weight gain is very, very slow after 1 year, so you don't really have to worry about it, but continue to give healthy food. Moving on to our next question, it's from Priyambada Swain. I'm sorry if I'm pronouncing it wrong. Hi Priya. My baby is born in 32 weeks with weight 1.27. Now he is complete 2 months and 2.8 kg. He is on formula feeding due to breast milk loss. I want to know how do I increase milk quantity and how to know my baby needs more feed. So Priya, to answer your question, yes, your baby is gaining good amount of weight as the details given by you, and especially you are worried that you have lost your breast milk. That is quite common. Sorry for the fly. That is quite common in mothers of premature babies. That happens due to extreme stress or hormonal changes or whatever the other things that we have to undergo. So that's usually there in parents of premature babies, and even I had that. I understand that initially we feel guilt and we feel extremely stressed and worried on how to get back the breast milk. If it is completely gone, it's okay, stop worrying about it. But if it's still there, continue to pump and then try to get the breast milk as much as possible. For example, if you're feeding 10 ml per feed and you only have 5 ml of breast milk, that's okay. You feed the 5 ml of breast milk and then give the additional 5 ml formula milk. It's totally alright. But if you have lost the breast milk completely, then don't worry about it. Without any guilt, go forward and give formula milk. Actually, in fact, formula milk is extremely nutritious and it has the consistent weight gain in the baby throughout that 6 months or 8 months or 1 year, how much ever you continue. So I know initially we feel guilty, but put the guilt apart and then you continue to give the feeding. Feeding is important, whether it's breast milk or formula milk. And I've made a detailed video on formula milk and tips for it, and breast milk and formula milk, which is better, and many more things. You can check out this playlist. And then coming to your next question about how to know if your baby needs more feed. So what you do is initially you give how much ever the baby is drinking, and then what I used to do is I used to put the empty bottle nipple near her lips. So if she continues to suck the nipple, then that is the sign that she needs more feeding. If your baby is pushing the bottle away and turning their head here and there, that's the sign that they don't want more feeding. If you put a finger, if they're still sucking it, that means they need more feeding. So what I suggest to you is every 1 week you try to increase the quantity of the milk, because as the baby is growing and gaining weight, they need more quantity of milk. So you can increase 10 to 15 ml of feeding in the next feed and try to see if the baby is finishing it. The best thing is to do is to just put your finger or put the feeding bottle nipple near the mouth of the baby. If the baby is sucking it, then they need it. If the baby is pushing it, then they don't need it. But don't get confused with sucking for comfort with hunger. Few babies want to do that like a pacifier, but few babies really are hungry. So you need to check the difference. So you will understand. The best thing is to get the cues from the baby itself. I hope that helps you. So let's move on to our next question. It's from Koduru Anisha. Dear Mama of Olive, that's so sweet of you. My baby boy was born in 36 weeks with weight 2.1 kg, has gained weight up to 4 kg, and now he is 3 kg old. But my query is, enough though he gained weight, he's too skinny. Looks like 1 month old baby. Is there anything to worry about him? So actually, now that you have said that your baby is 3 months old and 4 kgs, I think your baby is doing okay. But we need to understand that the normal babies, when they are born on day 1, they are around 3 kgs or 3.2 kgs, or in extreme cases it is also 3.5 to 4 kgs in some countries and in some places. For example, I was born at 3.5 kgs. That's normal baby weight. So however, when our babies are born low, that means that their body, they don't have enough muscle and fat in their bodies, so they obviously look skinny. As your baby is 3 months old, consider that your baby is 4 kg, that means it is around 1 month baby. Obviously, because the 4 kg is the weight of 1 month baby, who is naturally born. I mean to say, who has naturally born with proper weight. As our babies are born with little low weight, they do have that look, that appearance of a newborn baby until 3 months, because they try to develop muscle, they try to develop the fat in their body, so it takes time. So you can expect your baby to look healthy, chubby, and all around the age of 7 months or 8 months. That is the time you can expect. Let me also have a disclaimer that not all the babies are chubby. You don't expect every baby to be chubby because of the body type also. If your baby has a body type of skinny, then nothing in the world can make your baby look chubby. So you need to accept that fact of body types and then go on with it. As early as 3 months, they do look like newborns, and that's completely all right. So you wait up till 7 or 8 months, and then you will have this chubby baby. And hey, Olive, say hi. She's so excited. Okay. Say hi. Moving on to our next question. It's from Aisha Khanzullah. Sister, my baby is born in 35 weeks with 1.25 kgs and now she's 5 kgs. Now she's 9 months. Is the weight enough? Now she's eating and getting breastfeeding. Is this weight enough, sister? Please reply me. So Aisha, I think given the details, 35 weeks, 1.25 kgs, I think somewhere your baby is a low birth weight baby or an IUGR baby. So you can check out our playlist that we have done exclusively on IUGR babies. So I have invited Dr. Lata to speak exclusively about IUGR babies. So you can go check out this and watch all the videos so that many of your questions will be answered. We have made detailed videos on every topic. I think 9 months and 5 kgs, it's not appropriate for the age. I think your daughter is short in the weight gain process, so you can speak to your doctor and try to get the suggestions on how to get the weight back. For the interim, you can use coconut oil. You can continue to give ghee, fatty foods like ghee, dal, seasonal fruits, bananas, eggs, especially the egg yolks, and so on for good healthy weight gain. Moving on to our next question by Hemalata. Hi sis, I have twin boy and girl babies and born in 34 weeks 5 days. My girl is an IUGR baby weighing 1.35 kgs at the time of birth. Her growth was 31 weeks only. So how should we calculate their age and how to check weight and all? Will she pick up the milestone within 2 years? She's 11 months old and she crawled. How about their teeth development and speech development? Yes, Hemalata, as mentioned earlier, we made a separate video on IUGR babies, so you can check that out. And coming to the calculation of age, for premature babies, we do have corrected age, but for IUGR babies, I don't think it is like that. It is just however they are born, they calculate the birth age. Corrected age is only for premature babies is what I believe, but you can still ask your doctor for that. And then milestones, will they catch up by 2 years? Yes, when I spoke to Olive's doctor about milestones as she was a premature baby, the doctors told me that they will catch up by the age of 2. This is in case of premature babies. So in case of IUGR babies, you can ask your doctor about it. And then at 11 months she crawled. That's good. I think she is just catching up on her milestones because Olive was little delayed. She crawled after her first birthday. That is around when she was 13 months or 12 months finished. So then she crawled at that age. And then about teeth development, as I answered before, you can expect the set of primary teeth, the set of 20 primary teeth by the age of 3. And for language development, we made a separate playlist on milestones. So in that you can check language milestones. You will have all your answers for all your queries. So our last question for today is from Priya Thasaratan. Okay. Hi, my baby is crying a lot, want to suckle. If I take her, then she cries. Vomiting a lot for every feed. She may be affected with reflux. Elsie said, what to do? Priya, by your question, I really understand that you are really concerned about your baby. So I have a few questions for you that I want more details so that I can answer you. For example, are you breastfeeding or are you bottle feeding? Then second one is vomitings and spit ups are different. So I made this video especially to show you what are the symptoms of spit ups and how to stop them, how to control them. So yeah, you can check that video. And then the main cause for spit ups could be because of the gas accumulated. For example, if your baby is on bottle feed, so once they finish the milk, they continue to suck the milk, right? So when they continue to suck, they swallow a lot of air. Even in case of breast milk also, if they don't latch properly to your breast, then they do swallow a lot of unnecessary air. So when they swallow air, what happens is they have air here and the milk in the mouth. So it's like here it's air and here it's milk. So when they continue to swallow air, obviously this gas, it wants to come out. This gas that is stuck in their throat or stomach, wherever the region, esophagus. So when this gas has to come out, it will automatically push the milk out and then the gas comes out. So in order to avoid that, you need to burp your baby. So when you burp your baby, what happens is slowly the milk will come down and the gas will go up and then the burp comes out. And that's the mechanism, that's the reason we give burping. So what I suggest you is, if you're feeding, then stop the feeding just for a couple of minutes in the middle, after 5 minutes or 10 minutes, and then burp your baby. Once you get a burp, then again continue to feed. Like that, have burping many times in between feeds so that the gas will come up and the milk will go down, and then again your baby can have milk, because as they have reflux problem. And if you're breastfeeding or bottle feeding, if your baby is laying flat, even that has problems. So try to lay your baby at an angle so that whenever they drink, it goes straight to their stomach. So those are the few things that you need to keep in mind. So if you still have problem even after burping and even after removing the bottle as soon as the baby finishes the feeding, and you putting the baby in a slanting position, even after trying these things also, if your baby is still having spit ups, then you need to go check with your doctor. But if it's not spit up and it is literally a vomit, then you really need to get checked, because there may be some problem with that. So do try with burping, and then do try with putting the baby at an angle. So yeah, with that said and done, these are a few of the things that I want to touch. The rest of the questions are just mommies asking if the baby's weight is okay. For example, Bhavani has asked, my baby boy was born at 35 weeks, birth weight is 1.9, now he's 3 months old and his weight is 4.5 kgs. Is it okay? Yes, it is okay. So the rest of the questions I have seen, and all the babies are doing well. Do not worry about it. But one of the mothers, Shobha Kadam, said the baby was born at 36 weight. Her weight is 2.5 kg now and she is 1 month old. But you did not mention what is the birth weight. So I cannot answer on that. You can check that with your doctor. So few of the questions are mostly about that. And Azra Jaral, my baby girl is born 2 kg now after 4 months. Her weight is 4.4 kg. Is it okay? It can be a little better, to be frank. So yeah, these are some of the questions that mothers have asked, and most of the babies, they're doing good. So don't worry about it. So as my top tip, it's always about feeding coconut oil to your baby for good weight gain. So you can try that. So hey mamas, as many of your mothers, all of your mothers are handling premature babies, I want to suggest a wonderful book for all of you. It's a journal. I've especially designed this weight gain tracker journal, especially for premature babies during their early months. So in this weight gain feeding tracker, you can track their weight gain, their feeding, their milestones, their vaccinations, doctor's appointments, and many more things. So I highly recommend you get this. And if you also want more tips on how to take care of your premature babies at home, then you can get this book. It's Mommy, I'm Here, but a little early. It is especially about all the tips and experience along with the tips from the doctors about premature baby care at home. So I highly recommend you get these 2 books if you are a parent of a premature baby. It's not that I'm trying to push you to get these books. It's like really helpful to all of of you, especially the feeding weight gain feeding tracker. That's like really helpful for every mother. I highly recommend you get it as soon as your baby gets discharged. It's not because it's my product, but it's worth it because I know the value of it. I have been there, I have seen it, and I have followed it, and I have reaped the benefits out of it. So I want all you mothers to do the same. So with that said and done, we are done with our Q&A session. I really enjoyed, and thank you mothers for posing your questions in the comment sections, and I really enjoyed answering to all of you. I'll see you all in the next video. Until then, take care of yourselves and take care of your